Hey everyone, welcome back to another video. In this video, I'm going to be interviewing my wife, who is a labor and delivery nurse.
Hello guys.
If you want to gain more information about nursing or to improve your nursing knowledge in general, please consider subscribing down below. Also, let me know if you have any questions about a labor and delivery nurse. I would love to hear what you have to say and ask her and interrogate her. Okay, so the first question I have for you is, how is it being a labor and delivery nurse 3 years in? I asked you what it's like being a labor and delivery nurse when you were first starting out, and now that you've gained more experience, what are your thoughts about being an L&D nurse, and how is it working in that environment? Is it stressful? Is it calming? What are your thoughts?
I think honestly, as time has gone on, I actually feel like I've now identified more that I don't know in a way. Like, I think I started off naively going into it just with textbook knowledge and knowing how things should be in a very black and white way. But now that I've seen so many things go astray from the textbook way, that now I see what I don't know more than what I did. I think I'm more confident in what I do know, but I now see like my gaps much more transparently now. Is it stressful? It is stressful at times, but I definitely feel like I feel very supported at work, and labor and delivery is such a team effort. Like, at any time, all the nurses know what's going on with each other. You're never just in a room in a bubble, not knowing, what's going on in the room next to you, and those nurses, would never be uninvolved in your patient.
So a lot of like other labor and delivery nurses always ask if you need help, and
it's a lot of teamwork.
It's a lot of that's like the same as emergency. You get a lot of teamwork involved, and yeah, like when I went into a specialty, I realized how much I didn't know, and it's almost like the more you know, the less you actually know, because the more you realize you don't know.
What I realized is, when I started, I thought I like knew a little bit of the iceberg, and now I feel like I've like barely tickled the iceberg. In some ways.
Okay. Well, the next question I have is, how is the work life being a labor and delivery nurse? You get the 12-hour shifts. Do you feel like after your 12-hour shifts, you're exhausted every single shift? Or what is how do you feel? Do you feel like it's emotionally draining? Do you feel like it's physically draining? Do you feel like you feel really exhausted out of your 12-hour shift? What does it generally feel like after your shift?
I would say it helps that you're generally with one patient for the 12-hour time period. At times, like, you'll do an NST here and there. Maybe you'll have two patients occasionally, but you're usually with one couple, and so you are putting a lot of energy into creating a relationship with them. And at times, I guess you could say it's a little bit physically exhausting from holding a leg, maybe, but more, I think you just have to be someone that really connects with people emotionally and finds that rewarding, because if you find that draining, it's maybe not the area for you. If you're somebody that really gains energy from being around people and building those connections, then I think you'll do really well there. So for me, even if a shift is tiring, I really feel like it's totally worth it, just from the relationship that I built with people.
So it seems like you get to really know your patients very well, and during the 12 hours, you really have to develop a good connection with that person in order for you to essentially have a good shift. It's not like the merge where you have like 4 patients, 2 goes up to the floor, then you get 2 new ones, you go on break, and then all of a sudden you have 4 new patients. You typically have 1 patient, which is typically a couple, and then of course when they give birth, you also have the neonate that you have to take care of. So maybe explain to people, like, when you start your shift, what do you do when you start your shift?
I think it's really important to just approach each couple as if you're going to be their friend in a way, because they have to be super comfortable with letting you know how they're feeling if things don't feel quite right in the room, or even like often med students are involved, and you want a patient to be able to comfortably tell you if they don't want that person there and express their needs to you. And also, this is the most important moment of somebody's life. So if you feel, if you are really really present with them and try and treat them as a friend, I think that you can impact that experience so positively. But if they feel like you're kind of just a body in the room doing tasks, they really remember that. Because every woman, can talk about her labor and delivery experience to a T, and they can remember what that nurse looked like who really put them off. Yes. Or they can really, they remember the name of the nurse that made them feel like that day was just the best,
So like, so for example, if you start your shift at 7:30 or 7:45 or whatever the time may be, you start your shift, do you immediately go to that patient you're assigned and try and build a good rapport with them, or what do you do in your initial stages of starting your shift?
Yeah, definitely after report, I go into the room and introduce myself, and I quite quickly try to joke around. Like, I think humor is a big part of it because they're often terrified. It's like, it's very tense. It's like so much unknown for most people. And so to go in and I think just take away a little bit of the tension by joking around, they feel like then they can loosen up a little bit with you, and it doesn't feel quite so like impending, like it feels so scary. So I really try and use humor with people, but also just to I want to get to know who they are, and people love to talk about themselves. They love to talk about their pregnancy. Like, they love to talk about how they found out they were pregnant. These are common questions I try to use just so I can feel like I can really that I can even build a connection with this delivery.
So what are some of the nursing tasks that you typically do on a shift? Do you do a lot of IV insertions? Do you do a lot of pain and nausea management? Or what are the nursing core tasks that you do when you start your shift? So for example, you go into your shift, you establish a good relationship with them. What goes on in your 12 hours that is nursing related?
Depends on the birth plan of the person, but let's just say, at least at this hospital, that most women end up with an epidural. And so common tasks that I will do is starting an IV, giving medications via different routes, putting in a catheter. Often people end up in the OR, so they need to have you may even assist the surgeon. And you have to be completely responsible for the baby as soon as it comes out. So if the baby needs any resuscitation, it's entirely up to the nurse's first response to initiate that. So those are typical tasks.
I see. Well, thank you so much for this interview. I know it was short, but I really wanted to get your opinion now that you've been a labor and delivery nurse for a few years now. I guess actually one last question I have is, if someone's a nursing student or a registered nurse on a floor and they're looking to specialize, what suggestions and what tips would you have for them to get a better understanding, one, to get a better understanding of what it's like, and two, if they know that that's really what they want to do, what are recommendations you have for them going into that field, to get sponsored, or what would improve their resume for applying to that position?
If someone was just coming up to me and saying that they were possibly interested in labor and delivery and they were wondering if they would be a good fit or it would fulfill them in the way that they were looking for, I think I would say that labor and delivery at its core, those skills are all great that we're doing, but I don't think people generally go into labor and delivery for all of the skills you're going to do. I think it's that they just love people. And so for me, the meaningful, longer connections with people is what I thrive on at work. So I would say if you love getting to know people, and those connections is what really makes you feel good about your workday, then that would be a really, really good fit for you, as well as working with a team. As I said, this is not an area where you're kind of in your pod, you have your patients, and that's it. Everyone is very involved with each other. So I love the camaraderie. So if you're someone that likes working with a team and works well with the team and you're good with people, then I think that it may be for you. And then in terms of what maybe are some things to look into ahead of time, I think that I probably got into the training program early, only because I paid for myself to do a couple of the prep courses ahead of time, and that gave me a little bit of an edge because it made it less expensive for the hospital. So I would say even if you can afford to take one, it's 3 months, it's not that heavy to do over 3 months, one course ahead of time, you can come in and that shows them that you're taking initiative to try and get involved in this area in some way as much as you can, and they see that. As well as if you're still in nursing school and you can have You can have a final preceptorship choice. You could ask to go into postpartum, or even I know a lot of hospitals offer ESN positions. Right now we have an ESN student at my hospital, and she knows that this is the area she wants to do. But she's, it's very appealing to an employer, I think, to see a nursing student who's not even done yet try and get so involved. So, and almost anywhere, like I've had other nurses even shadow me. I've had people that aren't done nursing school just shadow me for a day to see what it's like. So if you're interested, you can always contact the unit manager and ask if you could shadow for a day, because it may not be what you think, both positively or negatively. So I think that's it.
Thank you so much for your time, Nicole, for this interview. I think it's going to help a lot of people that are thinking about doing labor and delivery. And it's always nice to hear different specialty nurses give their opinion on what it's like working on a labor and delivery floor, and kind of give guidance to nursing students and stuff like that. And for those of you who don't know, my wife, she went right into postpartum right after she graduated. She did a year of that, and then she specialized in labor and delivery, which is a completely different field of nursing. So, and if you're not on the fence between labor and delivery or postpartum, or emerge or ICU, I would definitely recommend staying onto the med surg floors, because then you're going to build your confidence and your skills, and it allows the flexibility of working in different specialties if you want to choose that. Thank you so much for watching this video. If it was helpful, please give it a thumbs up, and let me know if you want to see another video like this, or if you have any questions for her, leave them in the description, leave a comment down below, and I'll be sure to ask her and get her opinion on it. Or we might make a third video about this topic. Anyways, guys, we'll catch you in the next video.
Bye.
So first, you want to go on to my website, www.simplefitnurse.com. Then you want to go on to my books here. And then after that, you want to just click over the book that you want to download and click the download link, and it will automatically pop up in a PDF form. Thank you so much for watching this video, and we'll catch you in the next one.